What If Your Doctor Was Killing You? By Ali, Bam Bam, Lily, Aiden, and Zach. Doctors in medieval Europe used many different healing treatments for their patients. The most common was the use of herbs. Doctors would feed their patients herbs, have them wear herbs, put herbs on the bed covers, and other things involved with herbs, even if they're poisonous. Another common treatment was bleeding a patient. A doctor could open a vein or use leeches. Leeches are blood-sucking slugs, usually found in swamps and other dense places. The idea behind bleeding a patient was to restore balance to the body and spirit, but all it did was make weak patients even weaker, ending with death. Most of the diseases were caused by poor living conditions. People lived in cramped, small houses over busy streets. There are no garbage cans or even toilets. All debris was thrown out into the street or nearby canals. This resulted in many diseases and deaths. Common diseases included measles, leprosy, plagues, and the sweating sickness. Each was deadly, and some towns even restricted people who had that disease from entering the village. One of the most devastating diseases in history took place in medieval Europe and was called the bubonic plague. Otherwise known as the Black Death, the disease took people's lives hours after the first sign appeared. 1/3 of medieval Europe's population was killed from the outbreak. People believed that God was punishing them for their sins, and only those free of sins could survive. But it was the rest that carried the disease that spread the plague all over the world. So how would you feel if you knew your doctor was killing you? Not so good, but modern-day doctors have a lot more knowledge than the past, so instead of jars of leeches, you can find boxes of needles.